And our next presenter is Anne Maria Marete. She is a BSN RN, CCRN, University of Maryland School of Nursing in the Adult Gerontology Primary Care DNP. She's a candidate for the Adult Gerontology Primary Care DNP. If you would like to take it away, Anna, you're going to be speaking on depression screening protocols.
Yes, thank you so much. Good afternoon, everyone. Thank you for having me today. My name is Anne Marete. I'm a DNP student at University of Maryland School of Nursing. So for my DNP project, I did a quality improvement project implementing a depression screening protocol at a pain management clinic. Depression is a leading cause of disability worldwide, and chronic pain is associated with a higher risk of depression. Research shows that there's a 30 to 60% concurrence rate of pain and depression. So the aim of this project was to implement a protocol utilizing the Patient Health Questionnaire, also known as the PHQ-9. So the project was over a 12-week period, and my short-term goals included incorporating the PHQ-9 form into an electronic format. And then also my second goal was to screen all new patients for depression. So during the implementation phase, all new patients were screened, weekly chart audits were completed, and patients who scored 10 or greater on the PHQ-9 were referred for further management because they met the criteria for severe depression. So my baseline chart review revealed that no formal depression screening was being done at the pain management clinic. And then during my implementation phase, we had a 65% completion rate for depression screening. So of those patients, 64% had a normal depression screening, 36% screened for mild depression. These patients received education and they were going to be continued to be monitored, but no patients met the criteria for severe depression. So the findings from this DNP project show that utilization of the PHQ-9 led to increased depression screening. So incorporating the PHQ-9 within the EHR increased screening. It was easier for the staff to use. No paper, forms were needed. However, limitations of this project included just the short length of the project. It was only 12 weeks. And due to just COVID and all these changes in staff, that impacted the screening compliance. And lastly, there were issues with just the electronic forms at times not being compatible with the EHR. So there were also missed opportunities there. So in conclusion, the results highlight the need to screen chronic pain patients for depression. The PHQ-9 is a validated, short, and easy tool to use to detect depression. And buy-in from the stakeholders indicated an interest in expanding screening to established patients as well in their routine care. However, there's a need for further evidence-based projects to determine the optimal screening frequency for chronic pain patients. And thank you for your time.
Thank you, Anne Marie. It's a great topic, so certainly very forward-looking, and I'm curious to see what you guys end up coming up with. It may be in here, my eyes aren't what they used to be. How many questions do you recall are in this screening form?
It's 9 questions. It's very short.
Right.
9.
Okay.
Yeah, just.
I see how I could remember that. PHQ-9.
Yeah. There's a PHQ-2. It's very short, but the PHQ-9 is more validated and.
Okay.
Yeah.
No, that's perfect. 9-question electronic format, a lot easier to work in if somebody wanted to work that into their own clinic.
Exactly.
Private practice kind of setup. So very good. Well, thank you so much. Very interesting topic, and
Thank you.
good luck going forward. Sorry.